All right, Dr. Blumenthal back with you, Bethesda office with Natural Transplants. We are excited today. Farid is here all the way from Charlottesville, my old stomping grounds in college.
Yes.
Welcome, man.
Thank you.
Thanks
Good
for
to be here.
coming.
Yes, sir.
Appreciate you doing this video, and hopefully this will help some people out there,
Yeah.
just like the videos helped you. That's sort of giving back. Love it. If you don't mind, share your story with everybody. What brings you to us?
So I've been losing hair when I was right around 17, 18. And it's gotten worse over time, as you can see. So just wanted to, get some hair transplant, feel younger again. Yeah.
Okay, awesome. And so you've been on the Rogaine for how long?
About a year now.
About a year.
It didn't seem to help me a lot.
Yeah, maybe some baby fine hairs, but nothing real significant.
Exactly.
So today we're going to go big. We're going to try to get the plus today.
Yes, sir.
Get as far back as we can go. Again, though, the whole point, you want it to look natural. You don't want to bring it down so far and be so aggressive and have this permanent 18-year-old hairline on you. You want it to look natural. You want it to look age appropriate. Not only now, but also 10, 20, 30 years from now. Because this hair is going to be there forever. So I'm going to have Zane, I'm going to have you duck your head a little bit and Zane move in. So obviously, Norwood probably 6 back here. We're going to start from the front and just work our way as far back as we can go. Depending on how much density and how big the strip we can get, it may be halfway, maybe 2/3 of the way. We'll see. We'll try to pack it in as tight as we can and get back as far as we can. Awesome. You excited?
Yes, sir.
Awesome. Thank you so much for doing this. We'll draw everything out, do a little bit of shaving, and then we'll check back in with you in a few minutes.
Sounds good.
Okay? Awesome. All right, welcome back, everybody. Dr. Blumenthal with Farid, and we have took a little while with the hairline, but I think we got it. I think we're happy with it. As you can tell, it's to me it looks natural, and to Farid it looks natural as well too. We tried a little temple, drew little temples in there. We both didn't think it made as much a difference, so we're not going to do temples. Instead, we're going to use that hair, what we think, more wisely, and just go as far back as we can go. I'm happy with that decision. So I'm just going to have you drop your head again. So that's sort of the game plan. We're going to start from the front, work all the way back as far as we can go. I'm hoping halfway, maybe 2/3 of the way back in here, just depending on how much density and if we can get that extra strip on you, that plus procedure today. All right?
Sounds good.
One Valium we just took, hadn't quite kicked in yet, but how you feeling, man?
Oh, feeling great.
Doing all right? You excited?
Yes, sir.
Awesome.
Yes, excited.
We'll check in with you a little bit later during the procedure. Okay?
Sounds
All right,
good.
we'll see you in a little bit. All right, Farid, Dr. Blumenthal back with you here, and we are winding down, man.
Yes, sir.
How are you feeling?
Oh, feeling great.
Feeling okay?
Great. Yeah, pain-free right now, so
Good.
It's been a great day.
Awesome. It's been a wonderful day. I don't think you snored at all, but I don't think you went off too much. But we were watching some Netflix shows, had some lunch. You look comfy. We're just kind of filling in any spots that were possibly missed, putting in the last finishing touches, and then we'll check in with you probably about 10 minutes.
Sounds great.
All right. See you in a little bit. All right, Farid, Dr. Blumenthal back. We are done, man. Congratulations.
Thank you.
You got a smile on your face. How'd today go, man? Be honest.
Yeah, the day went great.
Yeah.
After the numbing shots, it was pain-free.
Good,
It was,
good. And you handled those like a champ. I didn't hear any screaming and no crying. It was great. Yeah.
Thank you. Yeah, no,
You did awesome.
it wasn't too bad at all. Everybody was professional. I had a really good day.
Good. Awesome, awesome. I'm going to zoom in just so we can kind of see the line. I'm really happy. I think that's going to look awesome. A little bit of oozing, which is normal. And we just talked about don't touch the grafts, so I don't want you to dab the grafts. We got back really far back, just to the front of the crown, and we sort of stop it in that curvilinear form, so it looks natural as the hair sort of starts and stops. And then we got the scar back there, and the incision. You kind of see through it, see through the hair a little bit, and see the suture line. That's going to look really nice. So I am thrilled. We really packed it in there. We got the extra strip. I love it, man. It is awesome, awesome. Any words of advice, words of encouragement for people that are thinking about it on the fence or
just do it? I'm glad I followed through with it.
Good.
I was on the fence, but then opening came out, and I was like, I'll go for it.
That's awesome,
Glad
awesome,
I
man.
did. Yeah.
Welcome to the family, dude. I
Thank you.
appreciate it.
Thank you.
I hope this can help other people. Like
Yeah.
you said, appreciate you doing this and sharing your story. Hopefully, we can follow along as the year goes on, and we can see the year after picture. It'll be great.
Yeah.
All right, Barry.
I'm
Take
excited.
care, man. We'll be in touch.
Thank you.
All right, bye.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.